My name is Moses Tanui. I'm a medical oncologist, clinical officer at Chogoria PCA. Working with love to take care of our cancer patients that are coming to visit us. Since I came in, we had a very low flow of our patients to the facility simply because we were not having a resident oncologist that was staying to receive our patients. But since I came, 3 months since May, we've been having a lot of patients coming in different type of diagnoses that are being referred, and even those that we are diagnosing within our facility. So we've had immense number of patients coming now that the service is available. I will say we've been growing since the beginning, but I can talk about the few weeks that we've had of last month. We've been seeing over 30 patients per week that are coming. Not like initially when we were having only 3 or 5 per week or 2, but now there is consistent and it's also growing. We might even have more than 40 or 50. That now we are looking at having over 100 patients per month, or even 1,000. The way I'm seeing projections that I'm having because of the service. The feedback from the patient is some of the time they even come and regret as to why they've not been knowing that there is a service. And for them, they have been wondering that they have been so naive to know that there is a service. And of course, they have been seeking for services far away from this place. And the goodness is our patient speaks to each other, they call each other. And now the feedback from the patient is so good that they are now knowing and understanding that we have a service at Chogoria, PCA, that the services of oncology is available, it is accessible, and it is affordable. So they are happy and they are proud of the facility, that they have seen that this is a milestone and it is a very, very important service that is now accessible to them. I'll say for sure we've been diagnosing quite a vast number of cancers. Currently we've diagnosed even more than 10 cancers that we've done it here, and we have also been giving treatment of the same. Top in the list is the breast cancer that we've been having. The second I've been doing is esophageal cancers and gastric cancers. We've also done one of the hematological cancer that seeking treatment has been so far, the multiple myeloma. We've done good diagnosis via bone marrow aspirate and trephine biopsies. We've even had quite a number of patients coming with bladder cancer and prostate cancers. So even other hematological conditions like leukemias in adults, chronic lymphoblastic, and even acute, we've seen them. And we are yet to see more, because now the service is now being known. And the services that we provide at our unit in oncology, we also do diagnostic. We've been doing bone marrow aspirates and trephine biopsy. We do even core biopsy, needle biopsy, for even breasts and even tumors, and also doing breast cancer screening, prostate cancer screening, and even diagnosis. Even punch biopsy for those that are having chronic wounds. We've diagnosed even multiple malignant melanomas from chronic wounds. We've diagnosed, even apart from cancer, doing punch biopsy of the chronic wound, we've diagnosed patients even that are having tuberculosis from the wound themselves. We even diagnosed a very unique disease called leishmaniasis from the bone marrow aspirate. So there's an array of outcomes from our own diagnostic arena and even the avenues that we are providing. Other services are chemotherapy that we've really achieved in providing this treatment, and even referral services that we've offered for radiotherapy for patients that are going out for radiation. Yeah, so those are among few that we've done even more of services in our facility now. Right now the challenges that we are having is one is all about finances, and some of the patient comes with no cover because they've exhausted the per year's medication money. So it is very difficult for us now to continue with treatment because they are lacking finances. If we have a kitty from the partners, that we can have a kitty where when a patient is struggling financially, we can also get the finances from the kitty. Another thing that we are also struggling or having a challenge is the beds and the recliners chairs to make them comfortable when they are taking the more than 4 hours chemo administration. So if we can get recliners, chairs, or even comfortable beds, we will very much will appreciate in a huge way. Another thing is availability of chemo pots. If we can get the plants, the chemo pots for administration, we will be saving time looking for veins, for fixing the cannulas. If we can have a donation of chemo pots, we can implant on our patients, which will fasten even the administration of treatment and prevent some of the aftermath of chemotherapy administration, of extravasations, or even reaction to the skin and even to the vessels. So if our partners can help us, for those even that can donate the chemo pots, we will appreciate so much. We will be having a breast cancer walk. And the essence of this is to raise finances, to build a kitty for our patients. I'm appealing to everyone across the country, whoever is listening. You can support it a small way. There is an avenue, even purchasing a cap, purchasing a T-shirt. That one, in a small way, we are contributing to the kitty. By working to pull together through buying, will help us to pull into the kitty and pull our hands together for this. If you have any small amount of money, there is a pay bill that you are having. You can donate, as small as it is. It will cushion way far the treatment, and you become a partner in curing and even helping our patients to get treatment here at Chogoria PCA. Join us from the beginning of October, which will be on the 3rd of October 2025, as we have a walk, as we commemorate the Breast Cancer Month, as we are also raising funds for the kitty that will be cushioning the services. So you're welcome to work with us from Chuka to Chogoria as we are raising the funds and creating awareness for breast cancer.